Punched, kicked, bitten, even stabbed. Healthcare workers across the country face these violent acts just doing their job. Nurses, who make up the largest group of medical professionals, say they often face the brunt of those attacks. Reporter Kristen Crowley takes a closer look at the issue and the possible solutions to fix it.
911 emergency. There's some guy in here that's nuts.
These 911 calls paint a horrifying picture.
Did he hurt somebody with the scissors? Yes.
They assaulted the employee until they passed out.
The pleas for help coming from inside a Florida hospital.
The nurses on the floor.
This could be nearly a fatality. This patient, this employee may not make it.
That employee was a nurse, Leela Malal. According to police reports and Lal's attorney, Karen Terry, a patient taken to Lal's hospital for mental health reasons attacked her.
Almost beaten to death. She has suffered extensive neurologic injuries, massive injuries to her face.
Is she breathing?
I have received phone calls and emails from healthcare workers, mostly nurses, throughout this country and throughout this state, who said this has been a problem for decades.
National Nurses United says more than 80% of registered nurses it surveyed have experienced violence, from verbal threats to physical attacks. Nearly half say the violence has increased in recent years. In Kansas City, Missouri, we sat down with 3 nurses who say handling violence is becoming part of the job.
Between weapons coming in, between people getting hurt or almost getting hurt, it's often.
It's enough that lawmakers at the federal level are trying to get involved. But there are differing opinions on how to solve this critical threat to frontline healthcare workers. On one hand, there's the Workplace Violence Prevention Act. It would require healthcare employers to develop and implement a comprehensive workplace violence prevention plan. Supporters of the bill say prevention is key, and the best way to get there is safe staffing levels, an issue National Nurses United says is at the heart of the violence.
The ratio that we advocate for federal legislation is 4-to-1.
When I was getting attacked, we had 1 staff member show up.
Had the staffing been different that day, do you think it could have prevented that attack?
I absolutely think so. Safe staffing is the best way to prevent workplace violence.
But not everyone agrees.
Because you add more nurses doesn't mean the violence is going to abate.
Claire Zangerly is the chief nurse executive for the American Hospital Association. That group is supporting different legislation, the Save Healthcare Workers Act, which would toughen criminal penalties for people who assault healthcare staff.
It's very much like having a police force in the hospital, walking the beat, walking the units, so that there is that presence of that those officers on those units, and that deters the crime.
And that's where these two sides are divided.
So at least 37 states already have enhanced criminal penalties on the books for workplace violence against healthcare workers, and many have had those in place for decades. And yet we've seen workplace violence rates continue to skyrocket.
Florida has a law with tougher penalties for attacks on healthcare workers, a law that was in place when Leela Malal was attacked.
It didn't protect Miss Law. I think if they had had additional staff, I think if they had had trained armed security, this would not have happened.
These nurses tell us for now, preparing is all they can do as the profession continues to wrestle with workplace violence, while industry organizations and federal lawmakers work towards a solution to fix it.
And according to the hospital where Lal worked, although 2 different healthcare regulatory agencies concluded that there were no deficiencies in its protocols, hospital leadership is developing security enhancements. And if you have a story, we do want to hear from you. You can call us or email our investigators at the address you see there on your screen. We'll look into any of your issues for the next Factfinder Investigates.